Tipping it forward spills the contents out the front. This creates that noticeable, sometimes excessive arch in your lower back.
And you mentioned this ties back to the hip flexors sometimes.
It often does, yeah.
Mm.
If those hip flexors are tight, they can actually pull the pelvis into that forward tilt as your body tries to find a way to stand or move upright. It's a common compensation pattern.
So it's all connected. The tight hips can actually encourage that arched back posture.
Definitely.
And what's the problem with having that arch when you're cycling? What does it do?
Well, that overextended position puts a lot of direct pressure, compression, on the facet joints in your spine.
Facet joints. Those are the little joints between the vertebrae.
Exactly. They're designed to allow movement, but when you constantly jam them together by arching your back too much, especially with the repetitive motion of cycling, they can get irritated, inflamed, and, painful, particularly on longer rides.
Oof, sounds pretty unpleasant, grinding those joints together. The Riva material uses a squat analogy, which I found helpful.
Yeah, it's a good visual. They show a squat with that really pronounced arch in the low back, pelvis tilted forward. You can almost feel the strain just looking at it.
Totally. And then they show the contrast, a squat with a nice neutral spine and hip position. They described it as looking comfy.
Right. And that comfort comes from better alignment, less strain on those joints.
But how directly does a squat translate to being on a bike? You're seated, it's different.
It is different, but the underlying movement patterns and postural habits carry over.
Right.
Even if the arch isn't as dramatic on the bike as in a bad squat.
Right.
Maintaining even a slight overextension for, 2, 3, 4 hours on a ride, that adds up. It's that repetitive microstress on the facet joints.
That makes sense. It's the duration that gets you.
Yeah.
Small errors repeated thousands of times.
Exactly. And they specifically call out mountain biking descents, too.
Oh, yeah. Why those in particular?
Well, think about descending. You're standing, absorbing impacts, bumps, drops.
Lots of jarring forces.
Right. If you're doing that in an already overextended arch to back position, every one of those impacts just jams those facet joints together even more. Yeah. They contrast that with what they call a mint attack position, which looks a lot like that good neutral squat, versus the overextended one where the back is arched and often the knees drift too far forward, which is less stable anyway.
Okay, so we've got these two big issues identified: tight hip flexors, pulling things out of whack and potentially referring pain, and this overextension compressing the spine, often related to the tight hips.